The presentation will be given by Nancy McGraw, and it will be followed by the answering of pre-submitted questions that were sent in via email to Sullivan BOCES. We will also take questions from those participating in the call tonight. In order to assure the proper flow of the meeting, we would ask that anyone who has a question that has not previously submitted it, please use the chat feature and enter your name and your question. And I will moderate and I will make sure your question is read. Any question that we're not able to answer, we will make a note and do our best to get back with a general answer to you. The chat will also be recorded and printed, and that will also be made available. The school districts of Sullivan County, my colleagues and I have been working hand in hand with public health since the beginning of the pandemic, and we've established an excellent working relationship and rapport with them. It's thanks to our public health department that the circumstances in our county have not gotten as bad as they could have been because of their diligent work and their staff's diligent work and their intercessions on behalf of all of the residents of Sullivan County. We have been fairly fortunate and have been riding out this pandemic together. So at this time, it's my pleasure to introduce and turn this over to Nancy McGraw, the Director of Sullivan County Public Health Department.
Good evening, everybody. And I want to thank Dr. DeFore for hosting this forum for everyone on behalf of Public Health and BOCES and all the school districts. If I need to speak a little louder, somebody just raise their hand. I hope that you can hear me okay. I just want to start by providing an update to our numbers in terms of where we're at currently in Sullivan County. We do have a dashboard that is updated daily during the week from Monday through Friday on the county's website, sullivanny.us, and you can just click on that link and go right to the dashboard. Our daily numbers today are 79 active cases. That is down slightly from the last few days. It has gone up quite a bit from the last 2 or 3 weeks. You know, we enjoyed a lull for quite a while, I would say, from August into the beginning of September. And then we started to see an increase in cases similar to what other parts of New York State are experiencing as well. And with more activity happening indoors, and with the fall and allergy season and flu season, you know, we do anticipate the cases will continue to climb, but our strategy from the very beginning has been to quickly isolate and quarantine any positive cases, provide information and support, and to make sure that transmission doesn't continue. Focusing on specific clusters and areas of the county is really an important strategy as well, so that those areas where there are growing number of cases, you know, we interrupt that transmission of the virus from person to person. We do have 379 people on isolation and quarantine. That is decreased from, I believe, almost 500 a few days ago. So, you know, people will serve their quarantine period or their isolation period and then fall off, and that's why those numbers change. On that dashboard, you can also click on the graphs to see, you know, where the trends are headed in terms of up or down or leveling off. We only have one person hospitalized currently. We're staying steady with 51 deaths. That has not changed in several months. We did have 12 new cases today. So each day we see a range from 4 to 8 to, you know, or more cases, and have to quickly follow up on those. And our team is doing a phenomenal job. And you'll be hearing from Christina in a little while regarding some of these questions. So the underlying message that we want to continue to get out there, in addition to, addressing your questions today, is as we head into, the holidays and we continue to deal with the pandemic, people are getting what we call nicknamed COVID fatigue. And it's become pretty challenging for some people, but we can't let our guard down. We need to continue to reinforce the importance of wearing masks and social distancing and hand washing. Prevention measures are really what's going to get us out of this, in addition to testing and tracking, contact tracing. And it's really important that we support each other as a community and continue to provide those messages as we continue to deal with the challenges that this brings for us. So with that, I guess we can go to the questions that were pre-submitted.
Okay, so I'm going to read the pre-submitted questions, and then Nancy, Christina, and Dr. Ellswig will field the answers to those questions. And again, if anyone has a question that has not yet been submitted, please use the chat feature. I ask that you please enter your name and the question into the chat. So the first question is, if a staff member needs time off for COVID-related reasons, must the school district notify the staff member of the provisions that they may be entitled to through the New York State Paid Family Leave and the Families First Coronavirus Response Act if the school district has already posted the employee rights poster and has already sent the employee rights information to all staff, or does the employee need to request these provisions? Nancy?
So it's really important that individuals and their circumstances, that they contact their human resources office directly, because your human resources office may not automatically know if you were exposed or you've tested positive, or they may not know right away, certainly not as soon as you do. So it's just a collaborative effort, but that information does need to be provided by employers, and we would refer you to your HR office.
Yeah, and I just want to speak to that for the school districts in the county. Some of the school districts may not have an HR office, but if you contact your immediate supervisor, if you're an employee of a school district, they will be able to direct you to the individual within the district who will be able to answer those questions for you. Question 2, if someone in your child's school has tested positive and your child was in contact with them, your child has to stay home. Now your child has come in contact with everyone in the household, obviously. Does everyone in that household have to stay home for 2 weeks aside from also getting tested? Christina?
So this question comes up a lot with regards to someone being a contact of a contact. The child is the contact of the index case, so they would be placed on quarantine. The family members, if they were not in contact with that positive initial index case, the initial positive child, they are not placed on quarantine, nor do they need to get tested. Only that child who is in immediate contact with that positive case would need to be on quarantine. And we do recommend testing between days 5 and 8. But it's not necessary to be able to be cleared at the end of the quarantine time if the child remains asymptomatic. Of course, if the child does turn up to be symptomatic, then they turn into a positive index case, and then their contacts would be elicited, and those contacts would be subject to quarantine, but only in the event that the child becomes ill would the family members actually need to be quarantined.
Do you want to talk a little bit about what we consider a close contact and the importance of, if there's a sick family member, that the siblings are separated from the sick child?
Sure. So we consider a close contact anybody who's been within 6 feet for approximately 10 to 15 minutes at any one given time. If you're in a household sharing a meal with someone or, sitting next to them on the couch, that's likely to make you a contact of someone who's positive. So if there's a positive person in the household, we ask that they isolate or isolate in their own space if that's possible. Obviously, if it's a small child, sometimes that's not possible. And that they utilize their own bathroom if that's also possible. Again, sometimes, a lot of the time, not always possible, but that eliminates additional opportunities for continued contact and possible transmission. And a person's quarantine starts, their 14-day quarantine starts at the last time they had contact with a positive case. So if someone is unable to isolate from their family members, essentially their quarantine period is extended 14 days beyond that initial person's, the index case's isolation period. So it could be up to a total of 24 days at a minimum if they're unable to separate from that positive index. So it's really important if someone's sick in the household that you try to separate that sick person out, because it will decrease everyone's amount of time in isolation and quarantine and help prevent shared and spread transmission.
Okay, thank you, Christina. Why isn't there more aggressive randomized testing occurring in the schools, batch testing, et cetera? Nancy?
So you probably have seen and heard a lot about the pool testing that's being done at the SUNY universities and colleges throughout New York State. That batch testing or pool testing has not been made available to the public or private school districts K through 12. And I don't anticipate that it will be so far in terms of information that I'm getting from the State Health Department. We have been doing planning for possible testing in the event that we need to do that in collaboration with the school districts, should there be some type of yellow zone or designation for a particular school district. We have submitted an application to the State Health Department for testing resources and supplies. We know that in the first wave of, I hate to use the word wave, but the first wave of testing supplies that were sent out to the metropolitan areas and the large counties that simply have a lot of cases in terms of sheer numbers. And so specific to schools, there is a plan in place, and we're collaborating with the school districts and Garnet Health to have a plan ready to go when and if we get testing supplies. It's always dependent on resources. In the absence of an outbreak at a school, we don't plan to do randomized routine testing, and it's not required at this point. Should that change, because things seem to change every week, then we'll regroup and come up with some additional planning.
Okay, thank you, Nancy. And are any facilities or organizations in the county conducting wastewater testing? Nancy?
So actually there is part of the county lies in the DEC watershed, the New York City watershed, and there has been some testing of wastewater happening in the Grahamsville area. And we receive those reports, I would say once a month. And there have not been any indicators of any concerns. And at some point, we anticipate the State Health Department will be doing some correlational research, possibly on wastewater test results for COVID-19 and try to correlate that to the number of cases in an area. Certainly, we have a very low number of cases in our county, comparatively speaking. So that's what we have available right now.
Okay, thank you. And why are the schools not uniformly adopting a mask mandate for all individuals on school property? Nancy?
So we have, from the very beginning, encouraged schools to have everyone, staff and students and teachers, to wear masks consistently and at all times in the building and in the classrooms, and especially in meetings and classrooms. Social distancing is also very important, but it's not a substitute for wearing masks. And if you have seen or you have concerns about certain schools who are not reinforcing the wearing of masks, I would ask that you address that with your school district.
And why were schools able to open without mandatory HVAC inspections and upgrades and repairs when indicated?
So in the beginning of the reopening for plans for schools were required to submit reopening plans, and we don't have specific information regarding inspections, upgrades, and repairs from a public health perspective. I would refer you to talk to your school districts, your superintendents, or your building principals if you have specific questions about that.
And to that question also, each school district in Sullivan County was required to submit a detailed reopening plan to the New York State Department of Education and the New York State Department of Health and receive approval for their plans prior to reopening. And every school district in the county's plan was approved. Number 7, why is there no education going on within the schools regarding the teachable aspects of COVID-19 and the role that children and young adults can play in decreasing transmission and protecting themselves and their families? Christina?
So while this is a great educational opportunity, we have provided a number of resources on our website and to schools individually at their request. Education within each school is a great idea, and you should discuss that with your district to see what's happening and what opportunities there might be.
Okay. Number 8, why isn't Sullivan County sending local inspectors out to ensure businesses are complying per the governor's mandate? Nancy?
Actually, we have been. We have been, especially in the very beginning of the pandemic, when we saw a number of cases rising and particular businesses were experiencing an increase among their employees. We collaborated with the State Health Department, Ag Markets, USDA. State Health Department has a district office in Monticello. So we've done some joint site visits to take a look around and do interviews, make sure they have the masks and social distancing and signage and hand washing stations and hand sanitizer in place. We routinely refer individuals and businesses to the New York Forward guidance, which kind of lists out very clearly what the requirements are. And we've also had to follow up on any issues that were complaint-based through the New York POS complaint form. So we routinely do this. We don't have a whole team that goes out every single day, but inspections are ongoing.
And just to add to that, Nancy, we get a ton of questions and calls about local businesses potentially not complying. If anyone has a concern about a local business, they're welcome to call the Monticello District Office and they will investigate that complaint thoroughly.
Thank you. And with a 7-day infection rate above 4%, including today's numbers, please bear in mind these questions were received and the deadline for questions was Monday. So some of these questions are several days old. What are the chances Sullivan County gets yellow zone and who ultimately makes that call? Nancy?
So the governor's office and the executive chamber are really identifying clusters throughout the state, looking at the data, analyzing the data. They've set up these metrics for a 7-day rolling average positivity rate. And ideally, what we hope that will happen is that there would be some sort of consultation with the state health department and with the local health department. And it would also include a conversation based on local circumstances if there were to be, excuse me, a yellow zone designation. Currently excuse me, my voice. Currently, our positivity rate, 7-day average is 3%. So it has decreased quite a bit. We were at a high of 4.5% on the 27th of October. Our new positive cases based on the number of people who were tested each day has slowly declined. So I'm hoping it continues to go in that direction, but if it doesn't, it'll be based on a decision that the executive chamber makes.
So the last question was a rather lengthy statistical question that was received, and it concerned calculations and the 7-day rolling average, and Nancy is going to speak to that question in generalities. It is far too long a question to read, but she will address it in general terms.
One of the questions in this involved, routine testing throughout the community. Some of you may recall that in May and June, we stood up a mobile testing site in a couple of different communities, I think Paulsburg, Liberty, and Woodridge. And that was really targeted testing in those areas of the county that were seeing a real jump in cases. And we certainly can do that again, should we identify that. As I said earlier in the, when we started this, that the number of cases seems to be scattered and community-wide transmission is occurring, although we do have specific smaller clusters. There's a lot of different planning going on regarding the type of testing for expediency and access. We're looking more at rapid testing, but currently rural counties the size of ours, population-wise, simply don't have the resources or access to testing for the population to do it continuously on a rolling basis. A lot of our planning, because we do have our healthcare partners and a list of testing sites, either both public and private, that people can go to. We updated that list recently and it's on our website. We'll share that after this again to make sure that everybody knows where to find it or has it. There is a state testing site at the Anthony Wayne Park, which is open to the public and is free. I know it's a drive to Bear Mountain, but that is also an option. For local folks, there is, a range of providers, that including Hudson River Healthcare, Crystal Run Healthcare, individual physician offices and pediatricians, Garnet Medical, as well, in terms of their outpatient physicians to access testing. So public health is really the safety net in terms of response for testing. And we will conduct testing if we see an increase in cases in a particular area. And we know that the community in that area is underserved and may not have access to testing.
Okay, Rob, can you open up the chat, please? Once again, if you have a question that has come up during the course of the conversation that we're having, please enter your name into the chat and your question. So this question is from Brenda. I do know my school is being very diligent about our safety, which I deeply appreciate. I'm an English teacher at BOCES. I was curious with regards to the most recent cases of COVID. Are they youth and or school-age children? Are we seeing an increase or additional cases due to reopening in school or among our students? Nancy, do you want to address that?
Do you want to take that, Christian?
I would say, while we have seen some cases related to, school-aged children, those cases remain in the minority. We have had a low number of students, and there are statistics, a school dashboard for each individual school district that's, publicly available on the New York State Department of Health website. So, you can check out the statistics with regards to each school, on that website. So, I don't think the cases are dramatically related to, reopening of schools or among students. I think it has a lot to do with community transmission and what people are doing in their private time as far as get-togethers or, other things like that, or their job-related responsibilities. So, it's very important that people continue to be vigilant, especially as the holidays approach, with regard to making choices, or sometimes very tough decisions about how they're going to choose to spend their holidays and who they may or may not be able to do that with. So.
And also to that question, it's strictly anecdotal, but there has been no major uptick among cases under children or school-age children since the reopening of schools in Sullivan County. Most of the contact tracing that has been shared with me traces back to adult exposure throughout the county. And we've been stressing this, and I know my colleagues around the county have been stressing this. We have to each be individually responsible. We have to set the example. We have to wear our masks. We have to socially distance. The adults are the ones that are causing these small clusters throughout the county. They're related to family gatherings, related to congregation, basically related to carelessness. If we are all diligent, we all do our part, we'll continue to keep a low overall percentage in the county, but the onus is on us. The public health department can't force us to do it. Superintendents can't force us to do it. Teachers can't force us to do it. We have to be individually responsible. Comment from the Monticello Central School District, Dr. Evans. Thanks, Nancy, Christine, and all at Sullivan County Public Health Services for your work and guidance throughout this crisis. And that is a sentiment that we all echo.
Jean wants me to share a link.
Okay, so we're going to bring up on your screen now a copy of the Sullivan County dashboard. Let's see if we can do this. So you should be seeing this link now. And if you scroll down a little, Rob. So we're going to share the screen. And the one on the left, Rob. That's the one we want to share.
Thank you.
And scroll down a little bit. Oh, you get the graphic there. So this is the most reliable data you all have access to. I find this data to be far more reliable than the state compilation. If you want to know what's going on in Sullivan County, go to this link. This is updated every day, midday, I believe.
After 1 o'clock.
After 1 o'clock, Monday through Friday. This is the data that's transmitted to the state by the Sullivan County Public Health Department. So if you want information, if you want accurate information, this is where you need to go. And this link is available on most of the school districts' websites. It's available on the BOCES website, and you can access it through the county website. So if you would go back, please, Rob, to the stop sharing the screen. Yep, that's it.
Show the comparative graph to reinforce the point I made earlier, if you want to go back to it.
Can you bring it back up, Rob?
So on the comparative trends box in the lower left-hand corner, if you hover in that little box,
Left-hand corner, Rob, the comparative trends chart. There you go.
See that little circle in the upper right-hand corner of that box? Click on that. That will enlarge it. And you can see at the bottom, you can see the tabs for comparative trends. If you click on the tab at the bottom that says active tab, yep, you can see since March, you'll see we had a very, at the height of the pandemic in the county, we had over 500 active cases in April, I would say mid-April. And, you know, then we did the lion's share of the work and activity in April, May, and part of June. And we've enjoyed a lull throughout the summer, if you can call it that, although I don't think there's a day gone by where we've not had a lot to do. But you'll see that in September, the cases started going back up after being very low in July and August for a long time. And in October, we're back up to just under 100 cases. So we want to see that keep going down. If you click on the quarantine isolated tab, you'll see the same thing there. And then hospitalized is there. So if you go back to comparative tab, you can see the graph you know, go up and down. And if you hover over it, you can see the actual dates and numbers. So this is where all the data is. We also have the map and lots of other information. And I just wanted to share that.
And one thing to just make note of is you might notice if you're statistical or math-minded that the number of quarantine and isolated per active case is larger now than it was back in the spring when we had so many cases, and that's because more things are open. And as someone who does contact tracing for the majority of the week, I'll say, you know, we do notice that most people have a lot more contacts that we're entering for them because they're out and about, or because, you know, they're going to work that might be, you know, a business that has been open since the summer reopened. So while, you know, the cases is lower than it was, there are comparatively more people per case that are being quarantined as a result of that because people are more active generally in the community.
Okay, thank you, Christine. Can we unshare the screen now?
I would also suggest that because we have limited testing resources, that the actual number of cases would be much higher if we had widespread testing. And we would be much more able to control the spread of the disease. And until that happens, we just have to be, as you said earlier, we have to be exercising all of the cautions that we know about: wearing a mask, setting an example, washing our hands, keeping social distance. But testing is really critical.
I'm sorry, the link for the data that we just showed you is there in the chat. And as I say, it's available on most school districts' website.
Can I just mention the list of testing sites? If you want to go back to that page, it's on the same page. If you go to scroll to the top, it says click here in the yellow part for the latest updates, or sorry, for just below that, for a list of local COVID-19 testing sites. And the yellow at the last sentence.
Yep, the last sentence right where it says here.
Please click here, down below that.
Right below it. That's it.
Yep. And that is updated. This information does change, and we make every effort to update it on a rolling basis if we find that things have changed, if appointments are needed, or if you have to be symptomatic to get tested. That sometimes depends on a certain provider's testing resources. They may, you know, switch to only testing people who are symptomatic at some point if we see a huge spike in cases, which we hope we don't. But right now, there doesn't seem to be a shortage.
All right.
And just something to be mindful of if you are interested in the free testing site provided by New York State Department of Health, like Nancy previously mentioned, the location is at Bear Mountain. You do need to make an appointment for that ahead of time. and you can call the New York State COVID hotline, and they can direct you how to make that appointment if you would like to do that.
I would also emphasize that it's important for everyone to get their flu vaccine, and for those who qualify, get their pneumonia vaccine as well, because it will be impossible to differentiate between COVID and the flu or pneumonia.
And we do get information on people who tested positive for the flu. We have had a few cases of flu already in the county, so it's out there. So get the flu shot, and it takes 2 weeks to build an immunity, so be mindful of that.
Dr. Ellswick, anything else you'd like to add?
No, thank you. I think you covered it all. I just would reemphasize the issue of social distancing, masking, washing hands, and just using common sense. And in the perfect world, we'd have testing for everyone so that we would have a better handle on controlling this disease. And hopefully that'll come soon.
Thank you, Dr. Ellswick. Christine, anything you'd like to add? Nancy?
I would just say that we'll be providing some clarification on questions we're getting regarding the changes to the travel advisory for New York State that just came out, and we're waiting for further guidance and clarification from the State Health Department. So we can share that in the future.
Okay, so folks, the email address that was publicized for questions, we will leave active for another week in case anyone thinks of something after this presentation. We will get those questions over to Nancy, and she would be more than happy to get answers if they're answerable, and we will get back to you. I want to thank Christine, Nancy, and Dr. Ellswick for joining us this evening. I hope you found the information presented informative. There's only one way out of this, folks, and that's up to each and every one of us. Wear your mask, social distance, and stay safe. Thank you, everyone, and have a good evening.